The one counting.
Right?
Yeah.
Starting, please. Last one scale. 3:32.
This is the moment where the first heart surgery in northeastern Nigeria began. The story of how this came about covers a decade of dedication from many different individuals and organizations. It involves collaboration from different countries around the world, together with varied medical professionals within Nigeria. It attracted patients from varied backgrounds and locations around the country, and led to Jos University Teaching Hospital, where this incision took place. Let's find out about our historic first patient.
I am Mrs. Dide Henley. I'm from Delta State. I'm here with my child. Her name is Ayiri Treasure Dide.
Ayiri, more commonly known as Treasure, has a patent ductus arteriosus, more commonly known as a PDA. A ductus arteriosus is a blood vessel in the heart, which is needed for development during a pregnancy. It usually closes within the first few hours of life, and in cases where it doesn't, it would be fixed before the child leaves the hospital, along modern medical guidelines. Treasure is now 9 years old.
I first noticed this condition when she was like almost a year. I noticed she was not growing well, and most of the times she gets sick often. And the doctor then that was seeing her in University of Benin Teaching Hospital told us that she will grow and the thing will seal by itself, that will cover up by itself. 2 years back, they now discovered that the hole has not covered, that is why she's going through all that. From then we have been from one place to the other. We won't attempt flying out to India like that. Before, my doctor in the University of Benin Teaching Hospital referred us to Dr. Daniels in Abuja.
You want to throw away his money? I'm hearing the sound. My ears are not blocked.
When I was doing my residency, I got interested in cardiology. Now then, there were no program for cardiology in Nigeria. I just felt that the country was too big, and I didn't see why we couldn't have a cardiac center. I didn't see why we couldn't have, things happening, So I went to train in Italy with the background that when I come back, at least the program, we will see something to do. We'll be able to diagnose better and all that.
She did some tests and she wasn't happy because prior to this time, the child was not on any medications, and she was very angry why this child is not on drugs. She would have been on drugs all this while.
Please catch the nearest person and tell them so that we'll take immediate action. If you don't, maybe we have prepared you for surgery today, for example. Like me now, we can't take him anymore. You understand? Maybe we have prepared you and something happens this morning and we haven't intervened. That might disqualify you for today. So please learn to talk. When I came back, the Hospital for Humanity said, oh, we want to come and help to do those things in Gariki Hospital. They heard I had just come back, and so they wanted a pediatric cardiologist to just come and help, and they now asked me to join them, and I was glad to join them. So that's when I first met them. That was like 2014 when we had the first mission in Gariki.
Hospitals for Humanity, who run the cardiac surgery program, was founded by Segun Ajayi, a doctor who has trained in the United States and in Britain.
Around when I was 18 to 19 years old, I came to Nigeria, and I thought I was Superman, and I drank tap water. The tap water, and I got very ill, and I had what we call gastroenteritis, severe gastroenteritis. I was hospitalized. I was at one of the best hospitals supposedly in Nigeria, and it wasn't comparable to the worst hospital in the United States. And at that moment, I knew that Nigeria had a better story to tell. I knew that Nigeria had a better story to tell than what it was telling as it relates to medical care. So that was the seed, that was the genesis of how I can personally make a difference in the healthcare of Nigerians. So part of our plan, part of our strategic plan was to find 4 different hospitals by which we can partner with. We would take their staff, cultivate them into basically world-class heart specialists, whether it was the surgeon, the cardiologist, the anesthesiologist, the nurses, the perfusionists. We wanted to take that group of staff, work with them, get them trained and up to a certain level, and then make it happen at their hospital.
In various teaching hospitals, you have doctors there. For example, they see a child that is not thriving, and they have a suspicion of there should be a cardiac lesion somewhere. So what they do is find centers where they have pediatric cardiologists and send such patients there. Once the program is running, the gist just go around, with the social media. People get to hear, and then some will have had the defect for long, and maybe for financial reasons, they couldn't go out. So once they hear there is a mission somewhere, they just want to come and be part of it. So they come down, and that's how, we just pull them.
She told us that some persons from the hospital for humanities, something will be coming. That's why she referred us to Jos here, and we came, and she got selected for the surgery. Normally, for her age, she already knows that any form of surgery and operation is risky. So she knows the risk, and that is why she was apprehensive. Am I going in there? What is going to happen to me? What are going to do? They're going to cut me, all those kind of stuff. She has a lot of questions though, like what are they going to do? Where these persons, why don't they do somebody else first so that I can see the person they have done for? All this kind of stuff. He was telling me, say, why did they have to be the first? Why can't they just do for that person so that I will see what they do? And these people, have they done for other persons before? That kind of intelligent questions. She was just asking me. So when the team came around and everybody was like, am I really truly going through this? So that was why she was worried.
Lift the leg. Lift the leg. Sit first.
What's your name? Gideon.
Treasure.
Gideon.
Okay. How old are you? 9.
With this being the first cardiac surgery performed at the Jos University Teaching Hospital, there is understandably a lot of interest from the local medical staff. Many people crowd into the operating theatre to see what the surgeon is about to do.
So this will be the first case which I am going to do. She is 9 years old. She's got a patent ductus arteriosus. That means there is an abnormal connection between the 2 big arteries, big tubes which comes out of the heart. So normally after birth, in 1 week or in 10 days time, this connection closes on its own. But in her case, the connection is still present. So she is around 9 years old. So you can imagine now she's lived with it for 9 years.
As you might have noticed, that is an Indian accent. How exactly did Indians get involved in this project?
So I've been to Nigeria earlier. So I came to Nigeria in May of last year. So that's when I got to interact with Dr. Ajay. So I met him and we've been discussing since then. No one gets paid, there's no revenue generation here. However, we do carry out surgeries free of cost, absolutely, at our hospital in India. We wanted to take this a step further, where we are doing surgeries for charity, even overseas. So this is the first time where we are doing full-fledged cardiac surgeries, and there's no more complex surgeries than cardiac. And it gets tougher when it's pediatric cardiac. So this is the first time we are doing pediatric cardiac surgeries overseas. and that too for charity. And we are very happy to be part of this, and we are very happy to continue this process for time to come.
There is a more blood going into the lungs, so the lungs are getting more flooded every time. So each beat, the heart is pumping more blood into her lungs, and then she gets repeated respiratory infections, and she become breathless, and she will not gain weight. This is the problem what she will face. So because of the lung pressure at this age, the surgery becomes more challenging. Most of the times we have to close these types of PDA in less than 3 months of age or maximum 6 months of age, so that the pulmonary hypertension doesn't develop. But in her case, the pulmonary hypertension is already developed, so that makes surgery and the post-op more challenging.
Today now I know the work we have to do for her to calm down. She said, this hospital that we're coming now, what are they going to use knife on me? I said, no, they just want to see something through the knife. And now that she said, you are lying. I heard everybody saying operation and everything, and I know operation, they use knife and everything. So why are you saying they will not they are saying operation and you say that they will not use knife? They will use knife. It's just that maybe you say my own is not serious. You can imagine that kind of intelligence. So that is pressure for you.
While Treasure is in the operating theatre, the intensive care unit, or ICU, is prepared. This is where the patients will recover after the operation.
There's the post-op care, which is very important, specifically for the kids. So in post-op care, basically the child has to survive and the child has to do well a certain number of hours after the surgery.
The ICU team, who will come from the United States, is made up of 8 nurses and a doctor. They bring expertise in looking after children who have had cardiac operations, much needed equipment not readily available in Jos, and work with a local team of nurses and doctors.
I'm a pediatric intensive care unit nurse from San Antonio, Texas, and I'm here in Jos, Nigeria with Hospitals for Humanity to save lives. I've traveled with Hospitals for Humanity before and watched lives changed and hearts healed by the hands of surgeons and nurses, and so I came back as a nurse and brought some of my co-workers back from Texas with me.
So when we first came in, the ICU was not ready. When I say not ready, it was basically under construction.
A week before the program started, it was as if it was going to be an impossible task. There was so much confusion here. Even when you people arrived, we didn't want to bring you to ICU because of all the confusion around, all the things that there. Electricians were there, plumber was there, doctors there, nurses, everybody was doing one thing or the other.
So we basically had to get an ICU, a full-scale cardiovascular pediatric ICU ready less than 24 hours.
In reality, it took 2 days to get the ICU up and running. As the ICU is crucial to the survival of the patients, that was 2 days out of 7 allocated for surgery, where no surgeries could take place. In these 2 days, oxygen was connected, local professionals trained up by the ICU team from the United States.
This is one of the IV pumps that our wonderful constituents from Texas brought us. And so we'll be using this to give most of our medications. You can run drips on there. You can do intermittent drugs, like if you just need to give an antibiotic over a few minutes, over 30 minutes, over an hour, whatever it is. And so we just were expressing that we will double check each other. The pump is smart, so it can do the math for us, but we must double check to make sure it's correct.
We have a women's group, a Methodist church in Bulverde. They make quilts for all the babies in our unit. So when they come back, they have a blanket, a security blanket. So we had the ladies give us some blankets to bring with us. So hopefully every child will go home with a little blanket. We also brought stuffed animals. Hosanna's mom donated stuffed animals for the kids. That's what you do when you work in a children's hospital. You learn what the kids really need. They need a blanket and a bear.
and procedures of transporting patients from the operating theatre to the ICU are verified.
All right, I'm on the patient. Oh, okay. That's what I said. Let's go. I'm demanding patients.
It's okay.
Doctors, my surgery is supposed to be done by 4 o'clock.
Yes,
and you're late.
Yes.
United, do we have enough of these? Yeah. Where's anesthesia? Do we have enough? There was 7 of us. Okay. All right. I'm intubated.
Oh, you're really...
Oh, yeah. You got to check my airway. Let's go.
We're simulating the transfer. Come here.
The operating theatre is a 3-minute walk from the ICU, but post-operation, there's a lot that could go wrong in this small distance.
Well, I moved them all once.
The portable monitors, portable oxygen and transport beds have to be practiced with, as the Jos porters, technicians and medical staff have never had to deal with a heart surgery patient before.
Except the patient's going to move herself.
Hey everyone, remember we're listening to our intensivists and our surgeon and our anesthesiologist. They're speaking right now and we're listening to what they're saying.
She's a case of VSD, operated. She's vitally stable inside the OT. Connect the ventilator right now.
Yes, we're still hooked up to the portable monitor.
After 2 full days of running the procedures and making sure everything was in place to keep patients alive after the operation, the ICU was finally ready to receive Treasure as its first patient.
We have never had water in this ICU. But because of open heart surgery, if you open our taps now, they are all running. Courtesy of open heart surgery. It's part of the preparation we made. And so many things were changed. Lights, I can't believe it. Now we are having lights, they can take like maybe for few minutes and it will come back. Never used to be the case. So even bulb was an issue, just ordinary bulb like this. It was a big issue, but see, every place is bright. Anyway, we were able to put the ICU together, and here we are.
There are so many things she on her own she wants to do, that I'm depriving her of doing because of I know the situation. As a child, she doesn't understand the gravity of what she's having. So I have to be restraining her. Don't do this, don't do that, don't do that. Like she likes ballet dance. She dances ballet. But I will stop her. Don't go for training. Don't do this, don't do that. Most sports she wants to participate. All-rounder. In academic, she was what we call average. But when it comes to games, sport, she's grade A.
See the syringe here?
In our school, the last time they had their inter-sport something, they have to come and beg me. Say, no, she can't. I said, no, the doctor has said she should be resting more. He said, but she wants to do it. She was crying. So I can't wait to see her do those things again. I can't just wait for her to just be the normal person that she really wants to be. I just can't wait.
As is a common occurrence, in the middle of the operation, NEPA has taken lights. Every year, 85,000 children in Nigeria are born with a congenital heart disease. We call this program 1K1M Project because we are looking for 1 million Nigerians to donate 1,000 Naira each. This money will enable us to provide 250 children a year with life-changing surgery. Please go to 1k1mproject.org to donate and join us as Nigerians trying to solve a Nigerian problem. We look forward to working with you. To be notified about further episodes, click the subscribe button. Please don't forget to click the bell symbol. Give us your feedback in the comment section and follow when new episodes will be released on Twitter.